Hey, good morning, some of you, and good evening as well. We'll start the session soon. We are going to do the mental health meds today. I highly recommend bring your book along with you, as I already messaged earlier into the group. So please have your book ready along with you because we are going to use the book today. And you're going to learn the meds with me, right? I'll start the session soon, everyone. Thank you. I'm doing good, Naprit. I look better today, I guess. So we're gonna begin the class today for sure. I hope everyone is doing good today and you're studying for sure. Hoping your mental health is going to be finished. So in today's class, we are going to do the mental health meds, right? And you really need to know how to study the mental health by yourself at the same time after the class as well. So I'm going to read in the way you're supposed to revise the meds as well. If you need to make some notes, highly recommend to make some notes during the class. But if you just need to listen me, you can just listen me as well. For the reference, I'm using the Saunders book today. And if someone do not have the Saunders book, that's okay. You can just listen me. And you can always watch these lectures later on the YouTube. It's always like saved over there after. So I'll send you the link as well if you're already with me right now in the WhatsApp group, right? Those who are joining from YouTube today, thank you so much. Yeah, they said happy to see you. Thank you so much. I really apologize, everyone. I know it's been a long time, like you were waiting for the mental health meds, right? But let's get started today, okay? Now, which one we supposed to do first today? We're supposed to do the antidepressants, right? Now, I hope everyone can see my screen and my voice is audible. Something not visible, something not audible. Always let me know in the chat box, please. Okay. So in the mental health meds, we have three different kinds of in antidepressants, we have three different meds in the antidepressants. Now, which one are three of those? SSRI, right? And the second one we will do is the TCA, which is your tricyclic antidepressants. And the third one, we usually call it like MAOIs inhibitors, or if you want to call monoamine oxidase inhibitors, right? I usually tell the students SSRI TCAs are more important. So if you're writing exam soon, those two maybe you want to do focus more. MAOIs inhibitors, okay, if you just want to read it. But I'll also give you guys MAOIs inhibitors today as a part of the homework. So make sure you do the homework as well. And when you finish the homework, MAOIs inhibitors later on, reading at home, make sure you do put in the comment section on the YouTube. what you learn about the question I'm going to ask you about the MAOIs inhibitors later on, because this way it will tells me if you're also studying at home after finishing with the class, because class is not just enough, you need to study also, right? So the first medication in the antidepressants, we're going to discuss about the SSRI, right? If someone has the ninth edition, maybe use the chat box for me, please. You can tell them, everyone, what chapter number of the Saunders book and what page number is that. So everyone can refer to that book for sure, right? Now, in SSRI, as everyone know, the method of studying the medication, as I always says, if you watch my previous video before you come to this lecture today, first of all, you need to know the purpose, right? Why you giving SSRI medication? As the name already indicates, it's an antidepressant, right? So it's against depression. So you are giving this medication, basically all three of them, to the depression patient, basically, right? Simple answer, why you using this medication for someone, right? Now, after you know the why for the SSRI, right? The second thing you need to know is the once you know why you're giving this medication, now you need to know the side effects and the adverse effects of this medication, right? If you watch my previous lecture, I already tell everyone in there not to study mechanism of action and why not to study mechanism of action. So if you're very new student to my channel, highly recommend after this video today, watch that video also. Then it will make more sense to you, like how to study the meds, right? Because in the previous lecture, I already tell the easiest method, how to handle, how to study any medication for your any nursing exam. So if you never watched that video before, maybe watch that video first today and then come back to this video later on, okay? So after you know the why, the second thing, as I said, know your side effects and the adverse effects, right? So I'm also going to refer the book right now so you can see with me which one is side effect, which one is adverse effect. You can write down in your own notes at the same time, because sometimes in the book it doesn't really differentiate which one is side effect, which one is adverse effect. But in the exam, they might gonna ask you, so you need to know, right? And even not just for the exam, when you're working on the floor as a nurse, you need to know what is expected and what is not expected, which is adverse effect after the patient taking this medication, right? Nausea, vomiting, cramping, diarrhea. Expected, right? You can also use your chat boxes at the same time. So I know everyone is studying together, they're participating together, right? So nausea, vomiting, cramping, diarrhea is the expected one. This is side effect. You know, after you take the pill, your stomach can be upset. So this is common for everyone. Dry mouth, again, this is expected, right? So you can put this as a side effect. Then we have CNS stimulation. It could be any signs of CNS stimulation, maybe getting irritated, getting agitated, restless. Now, CNS stimulation, I would say, after taking any medication, not just the mental health, it's always a bad sign, right? We never want a patient to become restless after taking a pill. Like, apply on yourself. If you are my patient today and you are taking this medication, do you think you were expecting that you will become restless after that? No, right? So this is going to be your adverse effect. This is not your side effect. Adverse effect means what? Something you're not expecting, something is bad, maybe dangerous, maybe emergency, right? Those ones we call the adverse effect, right? So this is not something you're expecting in. So let's put this in the adverse effect. After that, increased sweating, blood pressure changes. This is normal for some of the people around, right? Maybe blood pressure get changed a little bit, right? Maybe up or low, but usually remember most of the antidepressants, and I would say not just the antidepressants, most of the mental health meds, just so you all know, everyone does the hypotension. So hypotension, blood pressure low is very, very common after you take the mental health meds, especially the antidepressants, I would say. Now, once you know this, if someone got a photosensitivity reaction, that's not normal. So this is, you want to put it under the adverse effects. Insomnia, feeling tired, feeling sleepy, feeling empathy. Again, this is normal, right? Feeling drowsy a little bit. This is normal after taking a pill. And getting nervous. Nervous is not a good sign. This is very close to your CNS stimulation. So you want to put the nervousness under again in the same list, which is the adverse effect. I hope everyone has a book today, but those who don't have a book, it's okay. Just listen me more, and you can always watch this video later on when you have the book with you. Now, headache, dizziness, right? Headache, dizziness is again something common, something expected, right? So why is it expected? Changing in blood pressure. That's why, right? So I'm always expecting that as well. Now, when you have the next one you have is the weight loss, weight gain. Again, this is normal. Sometimes the clients, after they take any pill, either they can lose the weight because they are not eating enough at the same time, they don't feel like it, the stomach is upset, or either sometimes they have a craving for a particular food to eat it faster. So maybe the weight gain can also be possible, right, in rare cases, but this is not a dangerous something that I should put under the adverse effect and look into right away, right? So this is something can wait. This is your side effect. Now, decreased libido, which means decrease sexual interest, right? Again, this is common, expected in these clients. So you want to put it under the side effect. After that, apathy, tremors, seizures. Well, apathy could be normal as well, but if you have the apathy, let's say along with the other symptom, right? Let's say if I join two together, apathy plus tremors together, right? So I'm not expecting that, right? So that is one we call the adverse effect if two symptoms join together like this. But if apathy is just alone, that could be expected. Now, after that, seizures, I'm not expecting it. Tremors, I'm not expecting it, as I already said, right? Anyone know the meaning of apathy here? Because I think some of the students might don't know the meaning of this one. Anyone know? Maybe just type in the message for me, right? But if you don't know, let me know. Okay, very good. Lack of motivation. Very good. Another word I can say apathy means no interest, no emotion, right? You don't feel like to do anything. No motivation, no interest at all, and no emotions, you can say. That is the meaning of apathy. Very good. Lack of interest, right? So this is the meaning of apathy. Those students who don't know the meaning in case, you can write it down. Now, after you know what your patient going to have side effects, adverse effects, you need to do something in there because your patient is on this medication. So you need to know some common nursing intervention, what you can do with someone when someone is on this medication. So let's talk about the nursing intervention, right? But before I say the nursing intervention, it's a quick reminder for everyone, and especially for those students who are very new to my channel. Just so you know, I always teach in the middle of the night because I'm joining from Canada. And I always tell everyone, just in case if I leave the room for 5 minutes, just bear with me and try to understand, because I have a little baby with me who is sleeping at this time as well. So sometime if he gets awake, I need to leave the room for 5 minutes. Okay. So just understand it if in case I leave. Okay. But I will come back for sure. So moving on back to nursing intervention. Nursing intervention means what are you going to do as a nurse, right? So common nursing intervention I can see here. Of course, everyone knows you have to take vital signs because blood pressure lower is very common in here. Even I know some books, they also say high blood pressure too, but majority of the medication, they reduce the blood pressure, especially antidepressants. So most of the mental health books, they will give you low blood pressure. So I always go with the low blood pressure for the antidepressants. And apart from that, if you already know that, yeah, fall prevention, very good, Tessie. Any other student can also type at the same time as well if you know more nursing interventions. You can also do the weight check as well, because your client can also increase the weight or decrease the weight as well. So do the weight checking regularly. Very good. Safety precaution, very good, because Tessie also mentioned already fall prevention as well. Apart from this, I think this is very standardized. You always tell and teach all your patients, to avoid taking alcohol with the medication. So this is pretty common, right? Okay, this medication, remember, it has to take with meal. Some medication you take before meal, some medications you take with meal, some medication you take with the after meal, right? So that is why I highly recommend make a list for your exam purposes. It's just a one page, right? Make a line in between before food, with food, after food. So while you are reading meds with me starting from today, if you already know which medication with food, before food, and after food, you can definitely make your own list. So this is easy for you to revise actually one day before exam, right? So this is how you can make your notes. Now, apart from this, you need to monitor this patient for increased energy levels as well. And if in case the patient got an improved mood as well, because your patient might commit suicide at some point when they especially come out from the depression. So let's say one day you notice this person suddenly smile, laughing and talking to you, but before never talks, never smile, right? So don't think your patient is feeling better. It could be a sign of depression. Sorry, the sign of the suicidal, because they might thinking something about suicide at this point. So watch it out. If you see these signs, you need to be very careful. One-on-one nursing intervention right away. Now, apart from that, you need to also check the liver and renal function test for sure when someone is on these medication. And I think this is universal point, not just with the antidepressants. I would say any medication in the world, you always check the liver test and renal test as well. So this is standardized point. Now, when I say standardized universal points, what does it mean? You can apply this language anywhere in the NCLEX or the NORCET, which exams you're writing down, right? So only remember medication specific more points in your brain. The rest is just universal, right? Which you can apply everywhere. So like your vital signs, you can apply everywhere. Take with the food, majority of them you can apply with everywhere. Check the liver function test, as I said so far, you can apply everywhere. So these nursing interventions are common, I think. But if I want to really pull specific related to this medication only, let me skim and scan in here quickly for you. I would say the more specific about this one is educate your patient, do not discontinue this medication suddenly, abruptly by themselves. They need to consult with the doctor first, right? Why? Because if they try to stop this medication, rather than tapering down, they might gonna get the discontinuation syndrome in which the patient will have more GI distress kind of symptoms, right? And definitely the behavioral could be different as well, and perceptual thinking, everything gonna get changed too. So it's not a good sign. So always teach your patient to contact the physician first, healthcare provider first, get the medication taper slowly before they stopped it suddenly. And apart from that, I don't know if it's written here or not in this nursing intervention in your book. The most important point I remember that not just the SSRI, I would say any medication of the antidepressants and majority of the mental health meds too, they take at least 2 to 4 weeks to start work inside the body, right? Especially antidepressants. So you really need to teach about that to the patient as well at the same time, just in case family members come to you and they're like, medication is not working. So you need to look into when your patients start taking that medication, from what specific date, and it's been 1 month, 2 weeks, 3 weeks, or how long. If it's already been more than 1 month, then definitely you need to consult with the physician next, right? But if it's just between 2 to 4 weeks just now, you still need to educate them to wait until it start working inside the body, right? Another most important nursing intervention, serotonin syndrome. This is something I want to talk about too, because sometimes serotonin syndrome could be a part of diagnose related question into your NCLEX or the other nursing level exams. So what is serotonin syndrome? Why do you want to teach about that to the patient also at the same time? Serotonin syndrome basically happen when you actually mix two different classification together of the antidepressants, right? Especially if you take SSRI with MAOIs inhibitors together, right? Then definitely the body can go way higher up, right? So what is gonna be happening there? You will see elevated temperature, so it's high temperature, muscle rigidity, right? So body will be very hyperactive, you can say, right? And even the creatinine level is also gonna go high. And yeah, so everything is high I can see in here, like I would say not just this one, the blood pressure can also go high in this case too. So it's very hard to calm down this person. So serotonin syndrome is a bad sign if it's happened, because it takes time to patient to bring it back to the down, right? So always happen when you mix two classifications together. So try your best to teach the patient not to take two of them together. And also, even if physician ordered for you for your client, you need to remind them. And sometimes, this is not just happen when mixing together. This is also happen when you switch between one classification to another too quickly. You do not really taper the first one initially. You actually suddenly start another one. This has also happened at that time too. So watch it out at that point. Now, apart from that, the common other nursing interventions I can see here is, like in pregnancy, if there's a pregnant lady, she need to consult with the doctor first before she take these pills, right? And definitely the other common ones is like inform your patients about position slowly, because hypotensive effect could be there. So fall risk related nursing intervention, you can say. And yeah, that's it. Those are the common ones. I can see here what's something you're supposed to know in the SSRI. The one thing I forget to mention, everyone, like SSRI, some common examples of these medication which you must need to know for your exam, okay? So if you have like a book in front of you, you can highlight it maybe in there. There is a box, I can see it, right? But if you really just want to write it down, you can write it down as well, right? So citalopram, this one maybe you want to remember for sure for your test. And fluoxetine, 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 and then sertraline. And then you also need to know bupropion, right? I know this is something because in SSRI we have further classifications too, but NCLEX never asks those questions. They just give you the name of the med in the questions, and then they want to know what to do first on nursing intervention in there. But these are the common ones under that subcategories also, which you still need to know and remember it. Just in case you see these names in the question somewhere, at least you can recall, oh, they're talking about antidepressants. If you cannot recall in the exam, this is SSRI, that's okay. At least recall this is antidepressants, right? So you can still find out the answer for sure. Usually I would say the word ending into pram or the word ending into "ine," right? They are the usually antidepressants, SSRIs, right? Usually, most of the time, right? So this is how you can remember the first classification, SSRI. If there is any doubt, any question for me so far, definitely use the chat box for me. But if there's no doubt, no question for me, and you still find the class interesting, not so boring medication so far, let's talk about the tricyclic antidepressants then, right? I hope the pharmacology is not boring now, right? Because I know this was a major concern by lots of students. So you really need to know how to study this one, right? Uh, just give me 1 second. Okay. Students are texting about send the link for YouTube because some of them, they cannot join on the Zoom link. Okay. So maybe I'll send the YouTube link also in case if someone needs it. Give me 1 second, everyone. Okay, there you go. I sent it in case you need it. Okay, now let's go to the next one. The next one we have is the tricyclic antidepressants, right? Okay, someone is asking question, is it okay to use the Mosby book? You can connect with me later on the WhatsApp. Let me know for which exam you're preparing for, then I can guide you from there, okay? But for right now, today we're using Saunders books at this point in this class. So tricyclic antidepressants, again, antidepressants, that is the main purpose. Why you giving? For depression, right? This is what you need to know for sure. Now, is there any common name you need to know under the TCAs? Yes. The common name you need to know is the Amitriptyline, amitriptyline. And then you also need to know imipramine for sure. And then that's it. That's it. These two names for sure. Well, if you have lots of time, you want to remember the other names from the book, go ahead, right? Highly recommend if you want to, but these are the must you need to know if you don't want to remember the other names for sure, right? Now, once you know the names under this one, the second thing you need to know, as I said, side effect, adverse effect. Majority of them you will see same in here, slightly one or two may be different, right? Now, which one is different here? Well, maybe I'll talk about the similar first, so it's easy for you. Similar ones are, like increased libido, decreased libido, that's common again in this one. Anxiety, restless, irritability, we already covered in the back. So same answer will be here. Weight gain we already covered, and seizures we already covered. And then you also have the sedation. I think we already covered that part too. Cardio symptoms, yeah, hypotension, tachycardia, we already covered there too. Photosensitivity we also covered in the previous one too. So you don't duplicate because you covered already. What is the tiny difference? Anticholinergic effects. That's it. That's only you want to remember in this one. Okay. So anticholinergic effects, you did not read about them before, right? Now, what is the anticholinergic effects? When everything gets dry, low water everywhere. So which is like dry mouth, right? And difficulty in voiding, low urine output, right? Pupils get more dilated, more blurred vision at the same time, and constipation and decreased GI motility at the same time. So basically everything low in this case related to secretions, you can say overall in the anticholinergic effects. And this is something expected. This is what I call the side effect for this medication. Expected, normal, but still patient needs to tell the doctor. Even any medication has something common expected symptom. It's your job as a nurse to always teach the client they still need to report it, right? Even if it's normal. Now, after that, you go to intervention quickly, right? See, you didn't waste too much time in TCA right now. So interventions, I can say everything is pretty much similar. Again, something which is odd, I'll only talk about that for you. The first point, if you look, suicide related, again similar, so don't read about that again. The second point, again same, change position slowly, again same thing. Number 3, monitor the pattern of daily bowel movement. Yeah, this is you do with every medication. So again, it's common. Assess for urinary retention. This is specific with this medication because it has a cholinergic effect. So maybe highlighted this one. And then for the long term, for the client on the long-term therapy, you monitor the liver and renal function. I already talked about that earlier. Administer with food. We already talked about earlier. Administer the entire daily doses one at a time, preferably at the bedtime. Okay. This is you want to highlight it. These meds we recommend to give at the bedtime if possible. Okay, if bedtime. So highlight the bedtime for this one. And then instruct the patient to avoid alcohol. Again, this is normal. You tell every patient. This is common point, right? Avoid driving, very common. So this is again you can apply everywhere. When the medication is discontinued by the doctor, should be tapered gradually. Again, we already talked about that. So this is same thing. So don't read that again. The potential for medication interaction with the cold over-the-counter medication exists. This is same thing with every medication. Even if I did not read about in the SSRI, but you can add this point over there too. Over-the-counter medications are which one? Over-the-counter medications are those ones which you do not need physician order. You can simply go to pharmacy and get that medication from there. So like common cold medication, any medication for fever, for diarrhea, those are the over-the-counter meds. Even some herbal medication like tea, herbal tea, those kind of medications, they are also counted as an over-the-counter medication. So you still need to teach the client interaction could be happen. You need to consult with the doctor first, right? Apart from this, caution the patient about photosensitivity. Yeah, this is common with every med. Encourage oral hygiene, right? This is a different point. Highlight this one because here you read about anticholinergic care. So encourage the oral hygiene and use of hard candies, mouth rinse, because dry mouth is expected, right? That's why you're teaching this to the patient. And that's all about for this medication. See, pretty much cover up quickly in 15-20 minutes, 2 meds together. And the third med is also pretty much similar, but first thing I want to give you as a part of homework before I even read this one. So please, everyone, monoamine oxidase inhibitors, serious candidates. Try your best to type in the YouTube later on after you read about this medication. Now, what are you going to type up in there? I need to know minimum 5 side effects or adverse effects from you, right? And 5 nursing intervention, which you think you must need to do with this patient when the patient is on this medication, right? So give me 5 points as a part of your homework, because when I will see comment, then I know that you're studying. But if I don't see comment, I would be like, you're just listening class maybe, but you're not doing the homework, right? So please try your best to participate as much as you can, because the more you type, the more you're going to remember. This is scientifically proved as well, right? Not just typing. Anything you're writing down with the pen, you're going to remember for a long time as well. And the only thing I want to say in MAOIs inhibitor, to make it easy for you, only remember the name of the drug, MAO inhibitor, for your exam. If you want to remember just in case, right? The only you want to remember is Sertraline, this one. SCLEGI. Maybe you pronounce in a different way, I pronounce in a different way, but it's the same thing if you know the name already. So this one, if you want to remember just the name, right? The rest is student choice if you still want to remember the names or not, because I can see other meds are given in the book, but this is something you need to know as a name for sure. More important as compared to the other. Now, that's all about the MAOIs inhibitors. Let me check the chat box now if there's any question for me before I start the next medication today. So let's see here. Okay, I don't really see a question in here. Okay. Does everyone understood the antidepressant so far? Is it clear, not clear, something you have a question still for me? Please let me know. Even on the YouTube students, please let me know if you do have any question for me so far, or you do understand. Maybe you just want to say clear if you understand. So yeah, I know you're still there. You're not sleeping in the class, right? Okay, I hope it's a little bit interesting today. Not too boring pharmacology, everyone. Is it good? Yes? Okay, perfect. Okay, good. Thanks for participating. Now, let's see the next one together. The next one we're gonna do is we're done with the antidepressants. Now let's talk about mood stabilizers, right? Word already indicates stabilizing the mood of the patient, right? Which patient you give these medications? Common example, mania patient, right? And well, mood stabilizers, we have a couple of examples for sure. If you see the boxes in there, they give you lithium medication, and the other medication, if you want to highlight into the boxes in there, you want to highlight maybe gabapentin, clozapine, gabapentin, olanzapine, quetiapine, and risperidone. And Risperidone, if you want to just remember the names of the other one. But which medication you need to know in detail for your exam, where they can ask you more questions around it in there. The most common, the other one you need to know is for sure, is the lithium drug, right? So lithium drug, you must need to know for sure in detail. Even I can see in the book, they give you lithium drug more in detail rather than the other ones. The other ones, if you just remember the name, when someone has more agitation, their mood changes a lot, their behavior, and you want to stabilize someone in there for the mood, then you can just remember the other names, the one I just mentioned it now, right? Now, let's talk about the lithium drug and what is the more important you need to know in the lithium drug for sure, right? So, first of all, there's a lot I can see in the book. So, make it simplify for yourself. What do you need to know in the lithium drug, right? Yeah, very good, Tessie. Related to sodium, something in there you need to know, right? So, it's very complicated in there. So, I just want to highlight and make an easy job for you guys. The first thing you need to know is the therapeutic level, therapeutic drug level, basically, right? So therapeutic drug level, the serum level, basically, when your patient is on this medication, what is the normal value you usually check at that time? So just remember 0.6 to 1.2. Doesn't matter what units, 0.6 to 1.2. Why do you need to know that? Because if you find the blood work results less than 0.6, medication is not effective. You need to call the doctor, get the order for increase in the dosage of medication. But what if it's more than 1.2? Toxicity, right? You need to stop the medication first as a first nursing action, right? And then after that, once you stop the medication, assess your patient next for the symptoms, right? So I will quickly assess my patient for the symptom, but which symptom I will assess first? Something related to breathing first for sure. And then I'll check the rest of the symptoms, right? Then after that, once you assess the patient, you check all the vital signs and everything. Then after that, you need to call the doctor in here, right? So this is something you need to know the sequence. The way I tell you sequence, you need to know the exactly same way to handle your any NCLEX level of question, because I know a lot of students, they get confused what comes first, right? So if you study in this way at home, what come first and next, you can handle those questions pretty easily, right? So this is your therapeutic level. You need to know what you're going to do in there. The second thing you need to know of the cause of lithium toxicity. You know, why there is a lithium toxicity happen in there. The most common, I'll talk about it, which is you must need to know, but definitely there are thousands of causes as per research, like so many causes in the world. Nobody can remember every causes in there, but something related to your nursing competitive exam perspective, that point I'm going to talk about in here, okay? So main cause, I would say, what you need to know is when someone has, um, decrease sodium level in the body, decrease sodium level, right? And the second thing you see, dehydration, or maybe you can say fluid imbalance, or you can say electrolyte loss, whichever word you want to talk about in here, right? So if you see these two things, 1 and 2, the one I just typed up for you, that could increase the lithium toxicity, right? So that is why it is very, very important for you to teach your patient to take adequate amount of salt, intake, right? And 6 to 8 glasses of water, which is standardized, right? 6 to 8 glasses of water. Well, until unless maybe patient has another medical condition and doctor restrict the more fluid for some other reason, right? Otherwise, you have to give it these teaching for sure, because if the patient don't drink much enough liquid and they don't have much required amount of salt, they can have the lithium toxicity pretty easily, right? And when lithium toxicity happen, this is bad. Why? Let's see together. Because if lithium toxicity happen, what sign and symptom you will check with me? In the books, I know they talk a lot around, mild, moderate, severe. Nobody can remember that practically. But to make an easy job for yourself, just a little bit skim and scan. So for example, if you have a book in front of you right now, this is how I would read as a candidate. So I would be like, someone can have like more tiredness, lethargic, decreased concentration, ataxia, a little bit tremor, a little bit weakness, right? If it's just started symptom, right? And after it started, for some time, if you don't treat it, you still drinking less water, then these symptoms can get a little bit worse, more like more vomiting, more diarrhea, and then definitely my speech can be more slurry, tinnitus, and then blurred vision, even the muscle twitching also. Tremors can get more bad. If you notice, everything is getting bad in further. And the last one, if you still do not control this thing, it gets severe a lot symptoms. You can end it up in going into coma or seizures, right? Even no urine at all as well. So this is how you should study. Hallucinations, very bad at the very end, right? So this is how you should read about it. So don't read line to line in here, because I can guarantee you in any of your nursing competitive exam, nobody going to copy paste these answers in there, but they're going to put similar next to it, which you still need to know, right? And how you can find out the similar answer if you skim and scan like this. And this is how you make a picture in your brain about these sign and symptom toxicity. But once you know toxicity, you need to treat it, right? How are you going to treat it? Let's see that together. At the very last in the book, they write it down for you, intervention for toxicity. As I said, you need to hold the med, call the doctor. But before the call doctor, make sure you check the patient first. This is very, very important. If you want to write down and make a note here right away at the same time, you need to assess the patient number 2 step, right? Before you call the doctor. Because we have a rules in the NCLEX. You do something as a nurse first if you can do before you call someone for help, right? So if you can do something, do that first, always. Apart from that, definitely, these are the part of assessments you already done. Check level of consciousness, vital signs, cardiac status. This is done as a part of your assessment. But once you call the doctor, after that, you can obtain the sample, from the patient, because you want to check some levels like electrolyte, BUN, creatinine, CBC. That can wait. Blood work can wait. You can do it after you call the doctor, right? And monitor for suicidal tendency. This is, I will put it as a part of my second step where I'm doing the assessment of the patient. So after I quickly check the oxygen, maybe I want to check the patient if the patient have any tendency right now to commit suicide. Quickly, I'll see it, right? So this is how you make your own list. What to do first, what to do next. Now, once you know this much information about the lithium, I don't think so you can miss any question on lithium again, right? Now, that's all about the lithium one, toxicity related. But what about when the patient is on this medication and they don't have toxicity at all, right? Do we need to know adverse effects, side effects? The answer is yes, right? And do we need to know some nursing intervention and teaching? What are we going to teach? The answer is yes, right? Intervention. Okay. Yep, you need to know. So let's see common side effects, adverse effects with me. So polyuria, polydipsia, side effect, anorexia, nausea, side effect, dry mouth, thirsty, weight gain, side effect. Nothing serious so far. Abdominal bloating, soft stool diarrhea, side effect. Tremors, adverse effect. Inability to concentrate, adverse effect. Why I'm not able to concentrate it, right? And lethargic, fatigue, headache, right? These ones I would call again side effect, muscle weakness side effect, hair loss side effect, but hypothyroidism. I'm not expecting that. Why do I have it, right? After taking this pill, adverse effect. So see, this is how you think about these type of thing. And once you know your side effects list a little bit, you automatically know what are you going to do as a nurses in there and what are you going to teach actually. Teaching point main I already highlighted for sure before, as I said about salt intake and everything. So I'm not going to repeat that again. This is damn important. Don't forget, everyone. If you want to remember one thing about the lithium for me, for your exams, remember these points. The one I said on the top about toxicity stuff. Now, common nursing intervention, when someone even not even have the toxicity symptoms too, right? So what are we going to do in there as a part of common nursing intervention? Well, suicidal, you're checking, common point, what you did so far for any mental health patient, right? This is again you want to give with the food. Again, this is done earlier. Yeah, the most important I want to highlight in here is actually do not administer diuretics while the client is taking the lithium. Why? Why we cannot take diuretics? Anyone, please type it. Anyone, why you don't want to give the diuretics along with the lithium? Use your brain. Diuretics does what? Lose the water, right? Lose the water, lose the sodium. Wherever the water goes, sodium will follow in the same direction, right? So you want to make things worse further actually in here and put this patient on toxicity. If you give them together, very good. So that's why you don't want to give the diuretics. Highlight this point, highlight it, very important. After that, the rest are very general point. Alcohol, over-the-counter medication, you can apply anywhere, as I said, right? What's more important? Let's skim and scan quickly. Yeah, I would say this is pretty much the more important. The rest I can see is just standard points. Those who do not have a book, they are talking about like instruct the patient about sign and symptom of lithium toxicity. Teach your patient this medication takes time to be effective in the body. Now the book says 1 to 3 weeks, but as I said, make it simplify for yourself. Most of the mental health meds 2 to 4 weeks. So just keep your brain clear with that. Then they talk about check the weight, check renal function test, ECGs, everything, thyroid test. This is common. You can do in every medication again, right? So that's all about the lithium medication. So we've done 2 meds now together. Any questions until now, everyone? Or is it clear, clear, clear? Or do you have any question for me before I go? And again, Abrar, good morning. You just joined. I can see. Thanks, Harpreet, for this comment on the YouTube. I can see students on YouTube also today. That's good. Okay. Any other question? Is it clear? Easy, difficult? You want to highlight it maybe for me in the messages. Is it easy so far? Difficult so far? Right? Okay, Raki says easy. Cassie says easy. Good. Gurpinder is easy. Where is everybody else? I don't see your messages in here. Okay, everybody else, you find it easy or difficult or what? Or so-so, okay. Or you still learning pharmacology? What do you want to rate today? Because I know a lot of students don't like pharmacology, but you need to love pharmacology. Okay, Tessie says while hearing is easy. Okay. Daisies is like, okay. Do you have a book with you, Daisies? Just wondering with that, because that will make an easy job for you, what I'm reading right now. Okay, good, clear. Good, perfect. I'm just looking who is awake right now in the class. I hope no one is sleeping right now. Okay, good. Perfect. Yeah, this is you will learn with the time. I would say one tip for all of you, those who hate pharmacology. Let me talk about that first before I go to the next bit. This is actually not for the pharmacology only. This is actually for any subject or even like, for daily life also. Not just for the subject, for anything which you find it difficult in your life. And it's psychologically proved. If you tell your brain something easy, you will find easy right away. If you tell your brain, you know what? Oh my God, this is pharmacology, this is difficult, I can't remember all the meds, your brain will make you further scared and you will not remember that easily. I can tell you, right? All of you. It's just a message because I want to make you guys be alert, how to remember the meds easily in a simple way. Sorry, I'll be back in 5 minutes, everyone. Just give me 5 minutes, okay? Thank you. Hey, I'm back, everyone. Okay, sorry for taking a little bit break in there, as I already mentioned earlier, this one. Okay, so I hope everyone is still there. You're still connected, right? Let's see here. You guys are still connected? Yes, perfect. Okay, the next medication we're going to talk about is the anxiety medications, basically. So I'm just gonna take your page more down so we can type the anti-anxiety meds. These are okay, need to know for the test, but if you can skim and scan, it's a great idea, I would say, right? So anti-anxiety medications, which we also call benzodiazepines, right? So those ones we're gonna discuss in here. Just a second. Yeah, benzodiazepines. Okay. Now, which one you need to know out of them and why you're giving these meds, as the name already indicate, anti-anxiety. So if you want to remember one word, why you give benzodiazepines or anti-anxiety medications to someone, the one word is calm down. That's it. When you want to calm down someone with the behavior, right? You give the anti-anxiety medication when they are having anxiety at that time. So the most common, I would say, the med's name, which you need to know under this category, right, is alprazolam, right? Alprazolam, clonazepam. And as I said, you can remember other names too if you want to, but these are the must need to know for everyone, right? Okay, I see the message here. This topic is great, but the pharmacology is crazy when it comes to the NCLEX. Okay, well, I saw your message. I know it seems harder, until you do the question. So what I'll do is we'll do some question practice also one day on pharmacology, like some strategies on pharmacology, which is only class related to the pharmacologies related questions for your NCLEX, right? And then you learn with me how to answer those questions too, right? Because that will help you definitely to understand how to handle any question in there. And one thing I want to say for that student who typed this message on YouTube, I was telling about something psychological fact before I leave the class for 5 minutes. I don't know if you were there at that time or not. Tell your brain starting from today, pharmacology is easy. I know it sounds funny, like you cannot say that, when pharmacology is tough for a lot of students. But believe me, it will change your mind. Like this happened with me, right? Nobody loves pharmacology before. Did I love pharmacology before? No, right? But when I tell my brain like any topic, oh, I can handle it, this is easy, pharmacology is easy, I find it more easy actually, because I find more interest than in that topic to read about it. And then definitely I remember that information at the same time, right? So this is my a little tip. Try it. See if it works with you guys, right? If it does not, again, you let me know after a couple of days starting from today. But try your best to change that perspective first. I'm pretty sure it will change your the skills to do those questions of pharmacology starting from today. And you will find more interest in reading pharmacology with me then. Now, alprazolam, clonazepam, that is something I want to highlight it for sure. And then apart from this, you need to know diazepam, right? Diazepam. Now, again, these meds, the one I'm highlighting in here, these are commons for your exam purposes, something you want to remember that for sure, right? Then after that, lorazepam, right? Basically, anything ending into pam. If you see that, it's pretty common everywhere, right? Yeah, these ones I would say the most common, which you must need to know, right, for this one. Now, you already know the names, you already know why you're giving this drug. Let's quickly go over side effects and adverse effects list with me, right? Now, Side effects, adverse effects list. I can see in your book, they said daytime sedation, normal. After you take a pill, you feel sleepy. This is normal for a lot of candidates. So this is the for the clients. So this is side effect, right? Ataxia. I would say ataxia is also normal most of the time until unless you have ataxia with another CNS kind of symptom, right? Then you want to count it as a toxicity. Headache, dizziness, again, side effect. Blurred vision, double vision, side effect, right? Hypotension, side effect. Tremor, adverse effect, as the name indicates. Amnesia, adverse effect. I'm not expecting that. Slurred speech, definitely adverse effect. Urinary incontinence, that is something you want to say is the, what do you guys think? Urinary incontinence, side effect or adverse effect before I say it? Let's see. Side effect or adverse effect? Urinary incontinence in this patient. You think most of the patient can have this problem? What do you guys think? After taking the pill, to get calmed down. When Tessie says adverse, okay. What about the other students? Let's see. Even if you want to just try side effects, adverse effect, okay. Without wasting the time, I'll count it as the side effect, this one, Tessie, and the other students, not as the adverse effect. Why? Because it's making you calm down. You know, before when you were like more anxious, more anxiety, right? You definitely holding your bladder a lot in that situation, right? But when you get a calm down after taking this pill, sometimes you can have these episodes as well, right? So this is okay, normal for some of the client. This is not something an emergency. So sometimes, you know, you don't understand if this is adverse effect or not. Think maybe in that way, other students and also Tessie, she just answered adverse. So think in that way, is this something dangerous, right? That's something I need to look into right away. That will take you to the answer, right? That this is side effect in this one. So I hope you guys understand until here. Constipation, right? Again, side effect could be happen as well. And then CNS excitement. Okay, I'm not expecting that now. This is something adverse effect. Feeling lethargic, definitely side effect. Behavioral change, I'm not expecting that. This is the adverse effect, right? I hope everybody understand until here for sure. Now, after that, you know your interventions only. So skim and scan quickly 5, 6 common interventions maybe in here before we go to the next medication. So we only left with one more med after this. So when someone is taking this medication to get calmed down, you make sure you watch for agitation, trembling, tension. Why? Because if I see that, I will be like, medication is not working in that way, the way I want to do it, right? So this is something bad sign could be. Overuse maybe, right? Monitor for autonomic response like cold, clammy hands, sweating. Again, this is something I'm not expecting it if it comes all together, right? And then monitor for paradoxical CNS excitement kind of symptoms, especially in the older patients or debilitated clients, basically, right? I would say this is a bad thing overall, and you want to definitely check in every patient, not just in older ones or the other ones, but every patient is a bad sign. So always check for that. Visual problem, renal problem, liver problem. Okay, that's something you want to check in case something happening to that. Safety precaution, reduce the medication dose as prescribed for the older patient. This is only if prescribed, right? Otherwise, you give the standard doses what the doctor prescribed. And then assist with ambulation because drowsiness will be there. Yeah, I can see every point is common. I don't see anything really something related to this medication. Only one point I can see, the last intervention. Instruct the client not to stop the medication abruptly because if you stop medication abruptly here in this case, that can result in seizure, they said. Good to know, right? So this is something you want to highlight it because you will not find that seizure could happen after stopping the medication in the other mental health meds, right? So that's why you want to highlight this one for yourself, right? So this is how you see skim and scan, just read the med, you're done, right? As I said, this is okay, important med, not That very important. Even if you skim and scan a little bit, you have a brief idea, you're good to go, right? If anyone has any doubt, any question until here, let me know before I move on to the next med quickly. The next one I'm going to discuss today is the antipsychotic medications. Antipsychotic medications. Antipsychotic medications. Okay, let's talk about that. In the meantime, you can write down your questions and doubts if you have for me until here. I hope I'm not too fast, right? You guys are learning the pharmacology with me, but something's still not clear, let me know so I can explain you in a different way so you can remember the information for a long time, right? Now, if you want to remember one word for your antipsychotic meds, just remember stabilize, but what stabilize here? Not the mood. I'm going to talk about stabilizing thought, behavior, stabilizing thought, behavior, and perception of the patient is going to be changed, right? So when your client has a bad thoughts, bad behavior, bad perceptions, there you want to stabilize the patient somehow, give antipsychotic meds, right? This is how you can remember one word, right? Now, most common names which you want to remember until in here. Well, if someone is here for the NCLEX, they're not going to ask you this question, which of the following is typical antipsychotic or atypical antipsychotic ABCD? No way. Those are your nursing school level questions. Okay, you should not expect that type of question in the NCLEX. Someone is writing here NORCET exams or the other nursing competitive exams, let's say for a country like India, Pakistan, right? There they can ask you in your prelims those type of question randomly, like which of the following is the atypical one, antipsychotic. So then those students, they need to know as a separately, but someone who is writing NCLEX, you don't have to remember them separately, which one is typical, which one is atypical. For NCLEX students, just remember common names, which you need to know for sure. Now, which one I would say for NCLEX students, you need to know, even the other students also, haloperidol, you need to know under the typical. I'm going to read the typical first if you want to highlight the typical one. So haloperidol, you need to know for sure in the typical antipsychotics, right? And then atypical antipsychotics, you need to know olanzapine, and then quetiapine. You also did this one before too, right? Remember, we also discussed these meds earlier just now, 10-15 minutes ago. Where did we read about them? Where we can give these meds in other cases? Where did we read about them? Quetiapine, risperidone. Remember that? That was your mood stabilizers. Remember? Mood stabilizers, risperidone, quetiapine can also be a part of mood stabilizers too. So that means quetiapine and risperidone specifically, they're not just controlling, or you can say stabilizing thought, behavior, or perception. They can also control or stabilize mood changes as well, right? The mood behavior when someone is as a high mood behavior in that case. So I would say these are especially for those clients who are very, very highly aggressive. Especially quetiapine, risperidone is very effective in that case. But in case of an emergency, you usually want to give haloperidol as an injectable. Usually as a preference, most of the doctors prefer in the practicum when you see on the floor, right? Now this is the common names for sure, which you must need to know, right, in the antipsychotics. Now let's talk about the side effects, adverse effects, which you must need to know. There are a couple of side effects, adverse effects, right? Something I would say quickly, which one is adverse, which one is side effect. So see why I'm telling you guys the which one is side effect, which one is adverse effect. First of all, understand that thing. Why? Because I don't want you to cram the list. which one is adverse effect, which one is side effect. You're reading. Why? Because you're not going to get the same in the test, right? But what will works the best for you when you eliminate the answers and find the answers in the real NCLEX, especially if you're going for NCLEX or someone is NORCET mains exam, right? So basically at that time, you use the elimination method. And when you're using elimination method, you can easily recognize this is normal, this is side effect. I'm not going to pick up this answer because in question they're asking me adverse effect. So, it will just help you to eliminate the answer, to understand which is dangerous, which is non-dangerous, this is expected, this is non-expected. This is how it will help you there. I never read personally side effect, adverse effect for myself for every single drug. No. Practically, nobody can remember that. I can tell you guys, right? Nobody. It's a human capacity of the brain, right? Because pharmacology is very, very, very vast, right? But this is how you can make an easy job for you. If you know how to differentiate easily when you have a word in front of you in the question, you're good to go using elimination method, right? But if you already know how to eliminate that side effect, you automatically know your nursing interventions too when you look at the question, right? So try your best after you're reading like this from here today in this lecture, try your best the question which you're attempting at the back of this chapter, right? See, apply this technique there and see if it works with you, right? And as I said, wherever you're finding difficulty, you let me know. But I'll also bring the session on the MCQs also. So you can practice with me and see with me how I'm applying those skills and strategies as well. Okay. So moving on back quickly to side effects, adverse effects list, right? All of the anticholinergic, whatever they give you here, this is your side effects, right? Extrapyramidal effects, this is all your adverse effects, right? You're not supposed to be expecting them, right? So see, you don't have to read under in there. And then dystonias, akathisia, tardive dyskinesia, everything is adverse effect, right? Whatever comes under this list. If you have a book in front of you, you can see with me. And if they give you some other side effects at the very bottom of this graph, if you see in there, that will show you drowsiness, right? Drowsiness, common side effect, but I'm not expecting blood dyscaresis. So let's take it as a adverse effect. Pruritus, again, adverse effect. Photosensitivity, adverse effect. Elevated sugar, adverse effect. Weight could be gain, okay, normal, expected. This is your side effect. Impaired body temperature regulation, not. This is your adverse effect again, as the name indicates. Gynecomastia, adverse effect. Lactation, I'm not expecting that again. That is the adverse effect, right? So this is how you skim and scan. Do it quickly, pharmacology, because you don't want to sit for one drug for the whole day in front of the book for your test, right? Now quickly go to the nursing interventions related to this med. And I'm only going to read specific because you already know what other nursing interventions to do. Same copy paste is in here. So I'm only going to do the specific reading for you. So for example, number 2 point they give you here, monitor the patient for neuroleptic malignant syndrome. Now, what is that? Neuroleptic malignant syndrome. This is nothing. This is actually a complication, you can say, or you can say it's a reaction. It's a reaction happen when someone takes the antipsychotic meds. So after taking the antipsychotic meds, basically, or after starting with that pill, their body can get changes, right? So that changes we call neuroleptic. What changes are those in neuroleptic malignant syndrome? In that case, their body temperature go way higher, too much high fever, right? Too much high blood pressure in that case, right? And definitely the patient will have the high tachycardia, dysrhythmias, right? So this is pretty much common in the neuroleptic malignant syndrome. Apart from that, I would say if this is happening, with the patient, that can affect the breathing problem too. So dyspnea could be affected in there. And Even the patient can also have seizures with the high temperature, and their level of consciousness can be changed because they feel so confused in neuroleptic malignant syndrome when it happens. You know why it happens as a from the antipsychotic? You can say, if I want to tell you in a very common language, when someone takes so much antipsychotic med, you can say, and their body just get warmed up. In common language, you might notice, sometimes patient tell you body feels warm after taking those pills, right? Why does it feel warm? Because it's a reaction, right? So in common language, if I want to use a word, maybe Hindi, Punjabi right now, bear with me, everyone. Only one word I will use it in this class. It's like जब बॉडी गर्म हो जाती है, like आफ्टर मेडिकेशंस लेने के बाद, like एकदम से बॉडी का गर्म हो जाना, तो कहते हैं ना बॉडी बहुत गर्म हो रही है, पता नहीं मेडिसिन लेने के बाद क्यों गर्म हो रही है. That is what I call the neuroleptic malignant syndrome, because in this one, very, very high fever and confusion, because that fever, as you know, thermoregulation point is in here, right? That can further do the seizures, and even the person level of consciousness can be changed, right? High blood pressure, big problem also at the same time. And all these things definitely affect the breathing problem as well. So this is we call neuroleptic malignant syndrome, right? I hope everyone understand with me what is neuroleptic malignant syndrome and understanding so far what we're doing. If any questions so far, type it up, please. So I know you guys are still here. You know what's learning around in here, right? Okay, perfect. Thank you so much. Now, after that, these nursing interventions are very common. So I'm not going to read that. Check urine output, glucose, give with the milk. All those are common nursing intervention, like check vital signs and so with the antipsychotic. I'm only going to highlight the important ones for you. So let's see. The last important one is Mm, okay, so they say it's usually these medications, they usually not kicking in until 3 to 6 weeks. This is as per the books. But sometimes you will see in 7 to 10 days, the patient start giving you response little bit after they take this medication. Okay, this is something you want to remember a little bit, maybe for this medication particularly. And then there is another point, number 12, if you notice. It says inform your patient about some medication may cause a harmless change in urine color, pinkish to reddish brown. This one we did not read so far yet in any mental health meds. Maybe you want to highlight it. It's something specific only with the antipsychotic ones, right? Changing in urine color could be normal, but it's still there. So the patient still needs to know, and you need to still teach this client to the client. Apart from that, I can see rest everything is same, like hypersensitivity, alcohol points, changing positions, those are everything pretty common. Um, yeah, even discontinuing when their medication, it has to be like stop. You don't stop the medication like abruptly. It like you basically gradually slow down, right? I think we already know all these points, everyone. So I'm not gonna go into this, but if you do have any question until here, feel free to let me know. And with this way, congratulations, everyone. We are done with the mental health meds. See? Make it easy job, right? The rest of the mental health meds, I would say most of it, which I did not cover today, just so you know, not very important for your competitive exam, especially for the NCLEX, if someone is preparing for. But if you have a lot of time, you can still read them. Let's say you're writing exam after 3, 4 months, why not to read them? And if you're reading at home some other meds, you find difficulty in there, let me know so I can help you still with the other meds as well. But the only best way to reach me out, WhatsApp, okay? Or maybe type the comment here under the YouTube video, because I always reply back at the same time on YouTube's as well. So yeah, that's all about the mental health meds today. Now let me see your comment section in here. If anyone has any doubts for me before I leave today. Any doubts for me, everyone, or is it all clear? Did I make it easy a little bit? No easy still a little bit? Or are you still scared? What do you guys think? Yeah, no worries. Yeah, thanks, Gurpinder. Thanks, Tessie. Thanks, Rubina, Rajan. Okay, I can see some other students are coming out now. Easy? Okay, what about the other students? Here, hold on. Who else is in here today? Maybe I need to see some names. Abhi, Desis, Jatinder, Pradeep, Pooja, Rakhi, I think you already done, Riaz, and Vaibhavi, and some other students I can see on YouTube. Sorry, I don't know, your name is not there. So I'm just gonna say your username only, like peace for all mankind, Harpreet, Abrar, and there is the Ekai Koli. Okay. Any doubts until here for me? You guys good so far until here today with all the mental health meds? No question, no doubts? All good? Okay. So what I'll do now, everyone, I'll hang up this YouTube session now, and I'm going to send you another link quickly in the WhatsApp, only for 10 minutes. If someone has a random doubt for me, random question for me about the guidance related to the NCLEX or any other doubt how to prepare for NORCET exam, like any other random doubt for me, I have a 10 minutes before I go to my next class. So if you want to join with me, if you have a doubts in there, you can come to my other screen also. Okay. Thanks so much for joining the session today. And we'll see you guys for the next class very soon. Hopefully that will be cardio because I can see a lot of wording on cardio. So maybe I'll start with the cardio as a next. Okay. Thank you so much, everyone. Take care. Bye-bye.